submandibular and sublingual glands.
Right. So when we learned about like sympathetic and parasympathetic innervation, we learned that like the synapse is directly on the gland itself.
Yeah.
Right. So is that ganglion like on the gland? You know what I mean? Like when we learned like parasympathetic innervation,
Yeah.
it like innervated directly on the.
I don't know. Is there a synapse in the ganglia?
Yeah. Oh.
I think
So the synapsing in the wall of the organs is something that happens in the thorax.
Oh, so this
in the head is a little different.
Oh, okay.
Yeah.
A real ganglion.
Yeah, so the head, I mean, the parasympathetic and sympathetic in the innervation in the head is like, yeah, sort of opposite what we learned in the thorax and trunk, where like the sympathetics were sort of difficult in the trunk, a two-part system, a synapse and a ganglion, and a synapse in the target tissue. And then the parasympathetics are really easy because they were just with the vagus nerve.
Right.
And then the pattern in the head is sort of flipped, where like the parasympathetics are difficult because there's 4 parasympathetic ganglia that all have synapses in them, and then postganglionics from there to the target tissue.
Okay.
And the sympathetics are really easy because they're all postganglionic from the superior cervical ganglion. So in the head, like parasympathetics are more involved part. Okay, yeah. So there's a synapse there, and then to the target glands below the tongue. Okay. Anything else? Let's move on. So there's that ganglion there. V3 provides the general sensation to the anterior 2/3 tongue, which you see illustrated here. And again, chorda tympani riding with the lingual nerve provides the taste sensation. A nerve block to the lower teeth is a lot simpler than the maxillary teeth because, again, the inferior alveolar nerve is providing that sensation to all the mandibular teeth. So if you knock out this one nerve, you can knock out sensation to all of the mandibular teeth. So the injection is given right here, posterior to the third molar. And then if you need to do some surgery on the lower lip or sort of the anterior part, the skin anterior to the incisors, you get the mental nerve here, just inferior. Looks like it's just inferior to the canine there. And so here's a chart that just shows the innervation to teeth on the maxillary aspect and mandibular aspect. And so here you can see posterior superior alveolar from V2 gets sort of this territory in the middle, right here. And then the anterior superior alveolar nerve gets all of the anterior dentition, and then the skin overlying those general regions are done by the same nerves. In the mandibular part, in the mandibular teeth, again, all of the teeth are innervated by the inferior alveolar nerve, and then the skin overlying the posterior dentition is innervated by the buccal nerve, and the skin overlying the more anterior dentition is the mental nerve. Okay, so that's this is useful for that. And then in the palate, you get the palatine nerve, the greater palatine nerve, and the hard palate, the nasopalatine nerve, and this most anterior part of that. And then the lingual nerve. I'm not going to go over this, but this is for your reference to look at all the branches of the trigeminal nerve on the face, so the V1, V2, and V3 ones that you can actually see superficially. But we sort of went through these already, so I'm not going to belabor that. So now we'll talk about the muscles that are getting innervated by the mandibular part of the trigeminal nerve. So again, these 4 muscles of mastication, these 2 suprahyoid muscles, and these 2 muscles that we haven't learned that much about yet, but we'll talk about them now. So the masseter muscle you see is located right here, sort of from the zygomatic arch to the mandibular ramus, and that's going to elevate the mandible, which is also known as biting. So anytime you see mandibular elevation, think biting. And it can also do some mandibular protraction or to pull the mandible forward anteriorly. The temporalis muscle is this big muscle right here, which is a broad origin on the cranium, the inferior temporal line. It will insert sort of from this big fanned out muscle to a smaller tendon that will insert right on the coronoid process of the mandible. And that will also elevate the mandible in biting. But the posterior fibers that are oriented in this more angular fashion will also retract or pull back the mandible posteriorly. Okay, and that function will assist you in biting and to hold your jaw up against gravity. So if you've ever seen anyone passed out on a plane or in lecture and the mouth opens, it's because you're not activating these muscles and the jaw just sort of hangs because gravity will keep that open. And that's also why there's a lot of musculature devoted to biting or elevating the mandible, but not a lot of musculature devoted to depressing the mandible because gravity does a good job on its own. But the one that does is this one right here, the lateral pterygoid muscle will have two bellies. It will have a superior and an inferior head, so it will look sort of like this, going transversely in that infratemporal fossa. We'll see all these when we dissect that. And that will pull the condyle forward during biting. But the inferior head is one of these few muscles that will help to open the jaw. Okay? Whereas most of these muscles are, certainly the larger ones, are for biting. This part right here will actually help you open the mouth. Okay? Medial pterygoid is sort of very similar in action and orientation to the masseter muscle, but it's located on the medial aspect of the mandible. Okay, let's see if we can find a better picture of that. So here, right here, that's the medial pterygoid. So lateral pterygoid is sort of completely different in this transverse orientation, but going sort of superior-inferiorly is the medial pterygoid, which again is very similar to masseter. The way I remember this is medial mirrors masseter, so the same sort of function and action, but the difference is inserting on the medial aspect of the mandible, whereas the masseter would be out here on the lateral aspect. Okay, and here you see the medial pterygoid on the internal aspect, the masseter on the external aspect, and the lateral pterygoids here superiorly. Okay, so those are the chewing muscles. And now, just to review some of the suprahyoids, which you've already seen, mylohyoid, which is inserting on this midline raphe right here, and to the hyoid, and is also attached to the mylohyoid lines on the internal aspect of the mandible. Sort of provides the floor of the oral cavity, and I guess helps the tongue to push food between teeth. I didn't know that. Innervated by nerve to mylohyoid. This little guy anterior to that is the anterior villi of the digastric, also innervated by nerve to mylohyoid. Inserts on the digastric fossa of the mandible. Okay? And that functions like many of the suprahyoids to elevate the hyoid during speech and swallowing. It can also help open the jaw or depress the mandible. So the anterior belly of the digastric, as well as the lateral pterygoid, help to open the jaw. Okay? And so here's a summary of movements of the mandible and the muscles that perform them. So for elevation or biting, you have the temporalis, masseter, and medial pterygoids. For depression or opening the jaw, the lateral pterygoid and the anterior belly of the digastric. To protract or pull forward, you have masseter, part of the lateral pterygoid, and medial pterygoid muscles. Retraction is those posterior fibers of the temporalis. And then medial lateral translation, or chewing side to side, is accomplished by temporalis on the same side, and the pterygoid muscle and the masseter on opposite sides. Okay? So these other muscles that we haven't talked about, these sort of pharyngeal muscles, are going to be a little bit nebulous to you right now until we see them in dissection. But muscles that have the word tensor in the name are always innervated by V3. Okay, so when we learn all these, the ones that have tensor in the name, remember mandibular division. So the first of these is tensor belli palatini, is this muscle right here, and it's originating on the sphenoid. It's part of the sphenoid, part of the called the scaphoid fossa, and it inserts out into this broad palatine aponeurosis, and its action is to tighten the soft palate during swallowing. Okay, and that resists the passage of food into the nasal cavity, which is important not to aspirate your food, and it's also part of its function is to equalize pressure between the middle ear cavity and the space here called the nasopharynx. So if you've ever felt pressure build up in your ears, and if you yawn or chew gum or something, you can feel that pressure equalize, and that's part of this mechanism. Here's another picture of the same muscle here, so you can see the tensor belli palatini. The muscle fibers will wrap around this hook, this hamulus of the medial pterygoid plate, and fan out into this broad palatine aponeurosis there. Okay. The last muscle here, innervated by V3, is this tensor tympani muscle, which is a very tiny muscle in the middle ear cavity. And it inserts onto an ear ossicle, the malleus, okay, the hammer. And it essentially functions to dampen the sound of your own voice when you talk, so you can better perceive the accuracy of your own speech. Okay, and that's innervated by a little nerve from V3 to tensor tympani, and here you see it right here. It's just this tiny little muscle right here that's attached to what's called the handle of the malleus, right there, right by the tympanic membrane of the middle ear. And here it is blown up, so a bigger picture of the same thing. And you can see the eardrum or the tympanic membrane right here, and the tensor tympani muscle here will insert onto the handle of the malleus and serve to restrain how hard the malleus pounds on the tympanic membrane. Okay. This slide just shows the little twigs, the little muscular twigs from V3 to the muscles it innervates. So they got the nerve to tensor belli palatini right here, and the muscle belly right there. As you can see, the muscle wraps around that hamulus of the medial pterygoid plate. This is all medial pterygoid plate right here. Then you have the nerve to the tensor tympani, this tiny nerve on that tiny muscle right there, et cetera, et cetera. So all the nerves to the muscles here. Finally, I just want to summarize. So there's a lot of instances in the trigeminal nerve where there's different nerves riding along with branches of the trigeminal nerve. And so just to summarize them real quickly, the ciliary ganglion is connected to V1, and preganglionics from the oculomotor nerve, cranial nerve 3, ride with V1 branches to communicate to that ganglion. The pterygopalatine ganglion is connected to V2, and preganglionics from the facial nerve ride on branches of V2 to communicate with those cell bodies in the pterygopalatine ganglion. V3 has two parasympathetic ganglia attached to it. It has the submandibular ganglion, again preganglionics from the facial nerve, this time chorda tympani. This one is the greater petrosal nerve. And lastly, also connected to V3 right here is the otic ganglion, and preganglionics from the glossopharyngeal nerve will ride on V3 twigs to communicate with that. So you should know that all four parasympathetic ganglia in the head are connected to the trigeminal nerve. They all, preganglionics originating from different cranial nerves, 3, 7, and 9, run on trigeminal twigs to communicate to these respective ganglia. And then from there, ride out on different trigeminal branches to get to their target tissues. So the target tissue here is the eye, some muscles in the eye, a bunch of targets here, the lacrimal gland amongst others. the submandibular and sublingual salivary glands, and this one, the parotid gland. So the biggest salivary gland right here. Okay. I think that's my last slide. So now I'm just going to show a video of today's dissection, which is the lower part of the superficial face. I don't think there was sound.
They were talking, so I was
Still trying to know the answer.
Okay. As much as I know everyone wants to watch this right now, I think you may have to do this on your own time because there's no sound. No sound.
I know it does.
Yeah, I don't know why it was working.
You can narrate.
I'll narrate it, yes. It was the face.
You know, it should.
Super orbital.